Thank you for being here today. I'm Dr. Thomas Gilson. I'm the medical examiner for Cuyahoga County and the director of the crime laboratory. With me today I have County Prosecutor Tim McGinty, County Sheriff Cliff Pinckney, and Director of Public Safety for the County, Chief Bova, and other members of the County Prosecutor's Office. I'd also like to recognize that Steve Dettelbach is represented by Phil Angelo from the U.S. Attorney's Office. A couple of things to bring up today. We have a real shift in the trend of drug abuse fatalities in our county that I wanted to make the public aware of. And at the end of the press conference, I'll follow up with something that recently developed I think is a real point of major concern that we need to get the word out on. But I would be happy to tell you that heroin fatalities for 2015 are down 7% over 2014. That's the first time we've had a decline in heroin fatalities since 2006. The decline was about 7%, as I said. And while that represents progress, the unfortunate side story to that is that our fentanyl deaths, fentanyl is another narcotic, it's much, much more potent than heroin. They nearly tripled from 37 to 89 from 2014 to 2015. There is some overlap in these fatalities so that we do see heroin mixed with fentanyl. But unfortunately, the number of fentanyl deaths has really risen significantly higher, and the total number also rose. I do want to mention that the antidote naloxone, which reverses both heroin, fentanyl, and oxycodone and all of the other narcotics, was responsible for at least 166 reversals in 2015 as well. So I think the problem's getting better. In some ways, the problem's getting worse, but our ability to address it is improving. Naloxone is available through Project Dawn, which is at the Metro Health Medical Center as well as County Board of Health and other locations. It's also sold at CVS Pharmacy. On the heels of these number changes, I have to mention that January was a particularly disturbing month for us. It was the first time we ever saw an almost equal number of heroin deaths and fentanyl deaths, with 19 fentanyl deaths estimated for January and 21 for heroin in the same time period. Final results still pending, and again some overlap, but that's roughly one person a day dying from an overdose of one or both of these drugs, and we've not seen that before.